This is a quick video on Chapter 24, Drug Therapy with Nutritional Supplements. Very important when patients are needing extra nutrition. They can be assessed by different vitamins and their health status for the physician then to decide if they need extra vitamins, extra minerals, protein, carbohydrates, whatever it is that they might need. So we're talking in this chapter about vitamins, and there's fat-soluble and water-soluble vitamins. Fat-solubles are vitamin A, D, E, K, and they're stored in fat in the body. And a daily intake of these vitamins is not required because they're stored in the body. Although nowadays a lot of physicians put us on vitamin D, we do not normally, if we eat a good diet, do we need this vitamin. Water-soluble or B-complex vitamins and vitamin C, and a daily intake of these is necessary. They're not stored in the body, and they're urinated out every day. So every day you need to increase your vitamin C or B-complex. Now that's all listed on page 391, and you need to know this table, and you need to know if there's a deficiency in that vitamin, what it is. So an example, vitamin C is ascorbic acid, as you know, and scurvy, you can get scurvy if you don't have vitamin C. Folic acid aids in protein metabolism, promoting red blood cell formation and lowering the risk for birth defects. So that's why pregnant ladies are given folic acid as a prenatal vitamin. And if they don't, then the baby can have a CNS development deficit. So I want you to go through that table and know the difference in water-soluble and fat vitamins. Know which ones you have to take on a daily basis, which one you don't, and know the table and know the actions and the deficiency. Vitamin D, for an example, you get rickets. Vitamin A, blindness. Vitamin K, bleeding, bruising. One thing to remember on vitamin K, which you'll learn later, but if a patient has a cerebral bleed, a stroke, and you give them an injection of vitamin K to help stop the bleeding. So it's very interesting what vitamins do, and we don't think of it as terms of diagnoses, but they definitely are affected by what's going on in your body. Minerals are inorganic materials needed by the human body. We get them from soil and water, from eating animals, plants, and drinking water. Macro minerals are minerals we need a lot of, macro. Trace minerals, those are minerals we need less of. And that's in table 24.3. I want you to review that. So those are calcium, chloride, chromium, cobalt, copper, fluoride. You know, we get that in our water. Iodine, that's a thyroid hormone that is needed. And a deficiency of iodine causes a goiter. You'll learn about that in health science. Iron, you can get iron deficiency anemia. Magnesium. Phosphorus, potassium, needed for fluid balance and nerve transmission, muscle contraction. If you have a potassium imbalance, you know how you get leg cramps. Selenium, sodium, you need that for proper fluid balance, nerve transmission, again, and muscle contraction. If you don't have enough sodium, you can get weak, confused, have muscle cramps, that sort of thing. So if you see there's quite a few that are for muscle transmission, nerve transmission, like calcium, potassium, sodium, So the finite thing of nerve and muscle transmission is caused by these minerals. So you need to know that, need to know what the actions are and the deficiencies. One thing to remember is salt substitutes contain potassium. So the little fake salt that you can use instead of real salt has potassium in it. And that needs to be avoided in clients who take a potassium supplement, especially like heart patients, that sort of thing. Dialysis patients, they can't have salt substitutes because they're going to take then in too much potassium. And lastly, we're going to talk about enteral nutrition, and that's nutrition that's taken in by the GI tract. If you'll look on page 397, it shows some of the routes of enteral nutrition. And it is either through a feeding tube, through the esophagus, through a gastrostomy, through a jejunostomy, and those are the ways that we can give someone enteral nutrition. And you will definitely see that, especially if you're in a long-term care facility or in an ICU unit, or really even out on the floor if you have a really sick patient. There's a formula that's uniquely made to each of the patient's need. And the formulas are made for clients with different caloric needs and for conditions such as liver disease, renal, diabetes, wound healing, and COPD. Formulas are prescribed and should be given using the same rights of medication administration as you would for other meds, because this is a medication. It contains different amounts of potassium, magnesium, all of the vitamins and minerals that we were talking about are made up for this particular patient for their nutritional needs. And now sometimes you'll see just a can of Ensure or whatever. People will take those through these tubes. But in general, the nutrition supplement is specially made for the patient. And then you will either have a patient with a feeding tube, one through their esophagus, a gastrostomy tube, which you see a lot of those, and a jejunostomy tube, which bypasses the stomach. And the main problem with these is that they cause diarrhea. So you have to be very alert to your patient and watch his or her skin integrity, and make sure that if they've soiled themselves, you get it cleaned up really good. And you really have to watch because diarrhea is definitely going to happen when people are on enteral nutrition. So that's a short chapter, but I wanted to be sure I went over it. So thank you very much.